Good morning. Today we will have a detailed discussion about ideal radiographs. In H.M. Wordsworth's, an ideal radiograph is one which has the desired density and overall blackness and which shows a part completely without distortion with maximum details and has the right amount of contrast to make the details fully apparent. Radiographic image is a two-dimensional image of a three-dimensional object. Generally, we use two terms to describe the dark and white areas on a radiograph. First one is a radiolucid area. It is a portion that appears dark or black. That is, it lacks density and it permits passage of X-ray beam with little or no resistance. Example, pulp and the airspace, etc. Next terminology is radio opaque. It is a portion that appears light or white. It is dense and it absorbs or attenuates the X-ray beam or resists the passage of X-ray beam. Example, the enamel, dentine, bone, etc. The characteristic of an ideal radiograph are: first one is a visual characteristic, second one is a geometric characteristic, third one is the anatomic accuracy of radiographic images, and the fourth one is adequate coverage of the anatomic region of interest. Coming to the visual characteristic, again it is subdivided into density, contrast, film speed, and film sensitivity and film latitude. The geometric characteristics, again, it's divided into sharpness or the detail of an image, the resolution or definition, magnification, and distortion. First, we will discuss about density. Density is defined as the overall degree of darkening of an exposed film. We measure the density by densitometer, and it is measured as the optical density of an area of an X-ray film. Darker areas represent heavier deposits of black silver particle. So density is thus degree of silver blackening. Factors affecting film density. The first is the factors in relation with the X-ray machine. First one's a kilovolt peak. When kVp is increased, penetrating power of X-ray photon increases, more number of photons striking the film increase, and there will be increased density. That is, kVp is directly proportional to density. Second one is milliamperage. Increase in Ma, increased production of electrons, subsequent increased production of the X-ray photon, resulting in increased density. Ma is also directly proportional to the density. Intensity of an X-ray beam. If the intensity is more number of X-ray photons reaching the film, thus again there will be increased density. Intensity is also directly proportional to density. Exposure time. Increase in exposure time, there will be increased number of photons. Again, there will be increased density. In short, exposure time is also directly proportional to the density. Fifth one is the source to film distance. As the distance is increased, the intensity will be decreased, resulting in decreased density. So density is inversely proportional to the distance. Next is filtration. If added filtration is used in X-ray machine, it will decrease the amount of X-rays reaching the film and it will decrease the density. Finally, the use of grid. The use of grid decreases the overall density of the film. Second is the factors in relation with the image receptor. X-ray film type. High-speed film requires less exposure and we will get the desired density for the film. Use of intensifying screen requires less MA and produce the desired density. Factors in relation with object. Type of material. Greater the density of the object, greater absorption of X-rays, and less radiation penetrates to the rich film results in decreased density. Thickness of material or the subject thickness. If the subject thickness is increased, the density is decreased and vice versa. Internal structure or shape of the object. Different internal structures result in varying density of resultant radiographs. Now, after discussing the factors affecting the density, we should know what is a characteristic curve. It is a graphic plot of relationship between the film optical density and the exposure. It is also called Herter-Driffield curve or HD curve. It gives us information about the film contrast, speed, and latitude. Coming to the second characteristic, that is a contrast. Contrast is defined as the difference between the optical density of 2 points on a film that have received different exposure. Accordingly, there are two types, high contrast film and low contrast film. High contrast film. It has very dark and very light areas. Dark and light areas are strikingly different. It is useful in detection and progression of dental caries. And also, high contrast films are called as short scale contrast because there will be few shades of gray. Low contrast film. It has many shades of gray instead of black and white areas. They are useful for detection of periapical and periodontal diseases, also called as long scale contrast because there will be less white and black areas and there will be more shades of gray. Factors affecting contrast of film. 1. In relation with the patient, the tissue thickness. If the thickness of the material is less, the contrast is decreased. Factors in relation with the X-ray machine. First one's a KVP. If high KVP is used, more X-ray penetrate the film, more shades of gray seen, results in low contrast film and vice versa. Penetration power. Quality or penetrating power of the radiation beam affects the contrast. Next one is the exposure rate. Brightness of the film directly proportional to the exposure rate of incident radiation. Any change in exposure time in excess results in low contrast film. Factors in relation with film. First one is optical density. Film with either low or high densities exhibit poor contrast characteristics. Next is the speed of the film. Film with maximum speed shows less contrast compared with low speed films. Type of the film. Direct exposure film shows adequate contrast, while screen film combinations or indirect exposure film will have less contrast. Coming to emulsion, double emulsion film have less contrast. Also, film consisting of thicker emulsion will be good contrast than with thin emulsion films. Factors in relation with processing. Overdeveloped or underdeveloped film shows low contrast. High contrast is obtained at high temperature and vice versa the condition. Scatter radiation. Stray radiation as a result of background fog or due to scatter from within the patient produce unwanted density which will eventually reduce the contrast. Scatter radiation can be reduced with the help of a grid. Third one, fog. Fog is defined as those silver halide grains in the film emulsion that are developed even though they were not exposed to light or X-rays. Why do fog occurs? It is due to improper film storage at too high temperature, contaminated developer solution, excessive time of development. Finally, the fog will reduce contrast of the film. Coming to the next characteristic, film speed and film sensitivity. Radiographic speed refers to the amount of radiation required to produce a quality image of a standard density. Accordingly, there are fast film which requires low exposure, and there will be slow film that requires long exposure to produce a quality X-ray. Factors affecting speed. 1. Size of silver halide crystals. Larger crystals requires less radiation, thus increases the film speed. Direct and indirect films. Film speed more for direct action film, and it is more sensitive compared to indirect film or screen film combinations. Fast film. Faster the film, less exposure, less radiation dose to the patient, but poor image quality or sharpness will be reduced. Next is film latitude. It is defined as a measure of the range of exposures that can be recorded as distinguishable densities on a film. Types: film latitude and exposure latitude. Film latitude is a range of exposure to which X-ray film responds with densities within the acceptable range, whereas exposure latitude is a range of exposure of an X-ray film permissible for good diagnostic results. Factors affecting film latitude. Latitude is inversely proportional to contrast, and a wider film latitude, wider the latitude, there will be greater range of object densities, lower contrast. This type of film is useful if both osseous structure and soft tissue of a skull is required in areas where both is required. Narrower film latitude, contrast will be more useful for radiographing dental structures. Relation with KVP, high KVP, a wide latitude will be there. More areas or range of characters will be there. Coming to the second characteristic after visual characteristic is geometric characteristic. 1. Resolution. It is defined as the ability of a radiograph to record separate structures that are close together, also called the resolving power, and is expressed in terms of maximum number of lines per millimeter which the photographic material is capable of recording. Factors affecting resolution, type of film. Resolving power of an intensifying screen is less compared to direct exposure film. Resolving power of currently high-speed intensifying screen is 9 to 10 lines per millimeter. Next is speed of the film. More speed, less resolution. Next is sharpness. It is the ability of an X-ray film to define the outline of an object. It is measured in lines per millimeter that can be seen on an imaging device. Unsharpness refers to blurring at the boundaries. There will be fuzzy, unclear areas that surrounds a radiographic image. Usually in radiographically we call it as penumbra. The word penumbra comes from two Latin words, pen meaning almost and umbra meaning shadow. Umbra, a part of the shadow where all light is absorbed or an area of total darkness. Penumbra, it's an unsharpness of the image seen at the edge of the final image. Factors affecting sharpness. One is a geometric unsharpness. Due to crisscrossing of rays at the edges of the object, resulting in a fuzzy image border. Focal spot size. Smaller the focal spot, there will be a sharper image. Object film distance. Smaller the distance between the object and film, the image will be sharper. The target object distance. It should be as large as possible to get a sharper, clear image. In dental radiographs, the portion of structures closer to the film have greater sharpness. So naturally, the lingual cusp of the teeth is more sharper than the buccal cusp. Next is the motion unsharpness. Any movement of the patient, tube or film results in unsharpness of image produced. Decrease in exposure time, there will be less time for movement, so the image will be more sharper. Film unsharpness. First one is regarding with grain size. Faster the film speed, bigger the grain size, and the decreased image sharpness. Larger crystals do not produce image outline as well demarcated as smaller crystals. Fog unsharpness. Scattered radiation. Scattered, stray, leakage, or any other radiation not belonging to primary beam do not contribute to an image formation and it produces film fog. To avoid this, in intraoral films, we can add filtration, we can collimate the X-ray beam, we can use film packets with lead-backed sheets. For extraoral films, we can use grid. Next is unsafe safety light in dark room. Safe light use should be as per the given specifications. Unsafe safe light produce fogging. It should be verified using coin test in the dark room. Next is a chemical fog. It is produced by prolonged development or development at high temperatures. Potassium bromide or restrainer prevents fogging, restrain the action of developing agents on unexposed silver halide crystals. Next is the intensifying screen unsharpness. Intensifying screens used in extraoral radiography to reduce exposure to the patient. It works on the principle of fluorescence. Even though it reduces a patient exposure, the image will be unsharpened. Next is a radiographic noise. It is defined as the appearance of uneven density of a uniformly exposed radiographic film, seen on a small area of film as localized variations in density. The primary causes are radiographic motile and radiographic artifact. What is radiographic motile? It is defined as uneven density resulting from the physical structure of the film or intensifying screens, seen as film grainness caused by visibility of silver grains in the film emulsion, especially when magnification is used to examine an image, when high temperature processing is used, and when the film is used with fast intensifying screens. The two important causes of radiographic motile are quantum motile and screen structure motile. Quantum motile is caused by fluctuation in the number of photons per unit of the beam cross-sectional area absorbed by the intensifying screen. It's most evident when fast film screen combinations are used. Screen structure motiles are grainness caused by screened phosphors, most evident when fast screen with large crystals used. Radiographic artifact is a defect caused by 1. Errors in film handling like fingerprints or bends, errors in processing, splashing the developer or fixer on a film. Increase in intensity of an X-ray beam increases radiographic noise. Next characteristic is magnification. It refers to a radiographic image that appears larger than the actual size of the object it represents. Factors affecting magnification. Target film distance. Longer the position indicating device, more parallel X-rays from the middle of the beam strike the object rather than the diverging rays from the periphery of the beam. So there will be less magnification. Whereas if you are using shorter PIDs, less parallel X-rays from the middle of the beam strike the object and more of the divergent rays from the periphery strike the object, resulting in a more magnified image than that of the original. Usually in dental X-rays, we use PIDs of 8-inch distance and 16-inch distance. Next is object film distance. Decrease the film to object distance, lesser the magnification. And if we increase the film to object distance, the magnification will be more. Use of intensifying screen. Again, it increases the film to object distance. Naturally, it results in magnification. Next is distortion. It is defined as variation in true size and shape of the object being recorded. A distorted image results from the unequal magnification of different parts of the same object. Factors affecting distortion. Object film alignment. Object and film should be placed parallel to each other, otherwise it will produce variation of the distances between tooth and film, resulting in distortion. X-ray beam angulation. X-ray beam must be directed perpendicular to the tooth and the film, thus it will minimize the dimensional distortion. If horizontal angulation is increased, there will be overlapping of the structures mesially or distally. If we increase or if we decrease the vertical angulation, there will be elongation of the image. And if we increase the vertical angulation, there will be shortening of the image. Two baselines must be kept constant, which will help our radiographic errors in the angulation of the beam. Always and always, the plane of the occlusion should be parallel to the floor and the sagittal plane should be perpendicular to the floor. The film should never be bent and film holders is used to prevent movement during exposure. The second last characteristic is anatomic accuracy. A radiograph with anatomical accuracy will have a minimum of superimposition of images of adjacent tissues. A radiograph is said to have anatomical accuracy when labial and lingual semienamal junctions of anterior teeth are superimposed, buccal and lingual cusp of posterior teeth are superimposed, contacts of the teeth opened in at least one of the projections of a given area. Buccal portion of the alveolar crest superimposed over the lingual portion of the crest, and there should not be any superimposition of zygoma over the roots of maxillary molars. In intraoral radiography, more accuracy is achieved by using paralleling technique compared to the commonly used bisecting angle technique. And the last characteristic of an ideal radiograph is radiographic coverage. Adequate coverage of the area of interest depends upon several factors. Proper alignment of the film and the radiation beam to the area of interest, proper selection of the film types, proper selection of the film projection techniques. Image quality. Image quality describes a subjective judgment by the clinician of the overall appearance of the radiograph. It combines the features of all the ideal characteristics, density, contrast, latitude, etc. The detective quantum efficiency or DQE is a basic measure of the efficiency of an imaging system. So to conclude, an ideal radiograph is one that provides a great deal of information. The image exhibits proper density and contrast, has sharp outlines and is of the same shape and size as the object being radiographed. Has been said by Dr. Freni, what the mind doesn't know, the eye doesn't see. Thus, a dental practitioner or student must have a thorough knowledge with reference to interpretation of radiographs and other diagnostic imaging modalities. That is all for the session on ideal radiograph. Hope you had a wonderful session. Thank you very much.